In today's Health Watch, we're talking about the safety of hormone therapy for women struggling with menopause symptoms. And struggle is a word here. The treatment can offer relief for symptoms like hot flashes and night sweats, the worst. New research finds hormone therapy does not increase heart disease risk for menopausal women under the age of 60. Nikki Battiste spoke to one of the women who is weighing the benefits of the therapy against the risk. Nikki, good morning.
Good morning, Gail. We spoke with a woman in her 50s who suffers from perimenopause symptoms, but like many women, has been nervous about trying menopause hormone therapy. That caution lingers from a study about two decades ago that showed an increased risk of breast cancer. A recent study found only about 5% of menopausal women are on hormone therapy today, even though about 80% have symptoms.
This is my best friend. It's my fan.
Hot flashes.
It's called Fanny.
And sleepless nights are disrupting Isabel Kalman's life.
I keep her in my bag and just to cool myself off when I need to.
At 53, Kalman's symptoms are part of perimenopause, the phase before menopause when a woman's hormones start to decline. The most common medication is hormone therapy, which uses estrogen and, if needed, a progestin to alleviate symptoms.
Are you considering it?
I am. I've been on the fence about it.
Many women have been wary of the treatment because they were concerned it would increase the chances of breast cancer. The FDA has long mandated so-called black box labels on the medication, warnings about stroke, blood clots, dementia, and breast cancer. But the FDA is now considering removing some of those warnings.
This is a public health priority, and this is a sign that the FDA sees that.
Dr. Mary Rosser has been Kalman's doctor for 5 years.
Is the fear of the risk of breast cancer fair?
It's been overblown.
Dr. Rosser believes flawed research from about 20 years ago overstated the risks of breast cancer because that study focused on older women. As today's new study shows, timing matters. A woman's age when she begins hormone therapy, along with dose and delivery method, can substantially mitigate risks.
Generally, when would a woman begin hormone therapy?
So we have said to begin as close to the final menstrual period, and then you continue until about the age of 60.
Dr. Rosser spent the past 9 months working through the risks and benefits with Kalman, who has a family history of breast cancer.
I'm hoping, even if I do it only for like a year or two, that there is an option for me that can help me in the short term.
The new study says the ideal age when most women should take hormone therapy in order to mitigate risks is between 50 to 59. Recent research shows the right timing of treatment can even reduce the risk of diabetes and improve cognitive function. If you're considering treatment, of course, it's important to always speak with a doctor.
That's the most important thing. I'm sitting here so disappointed with myself because I was one of those women that believed that study years ago and didn't take anything and have spent years and years struggling with all these different symptoms. And now it's too late. So is there anyone who shouldn't take the hormone replacement therapy?
The new study shows if you're 70 or older, you should not take hormone therapy. If you're in that 60 to 69 age range, use caution. Dr. Rosser at Columbia University told me for some women who have had certain breast or endometrial cancers, they wouldn't qualify for systemic hormone therapy, but new studies show they might be able to safely take some local forms like a gel or a cream.
You know, your number surprised me in the beginning. You said 80% of women are going through the symptoms, but only 5% are taking it.
That is a wild.
I know,
Yeah, I mean, it's the
even though
power
we
of
know that
study.
it's better for us.
Yeah, and the stigma,
yeah.
which I think is slowly fading,
I do
thanks
think
large
it's
part to
fading.
social media.
Yeah.
We're talking about it here, we're talking about it. The other point I want to make, it can be difficult to find a doctor who really understands menopause because 20 years ago, the education in med school was minimal. It's gotten better.
Yes.
But I think it's important we talk about it. It's important for men to know about it too.
Yes.
Yeah. Segments like this help destigmatize it.
Exactly right.
Nikki, thank you so much. We appreciate you.